Today, I'm really excited to be joined by Dr. Caissa Troutman. She is a woman of many talents, and she's board certified in obesity medicine. She's a women's hormone therapy specialist. She's also trained in CBT-i, which is cognitive behavioral therapy for insomnia. And she's the founder of reMDy, which is a practice serving patients in Pennsylvania. She has a brick and mortar location in Camp Hill, Pennsylvania, and then she sees patients by telehealth all across the state of Pennsylvania. And today we are going to be talking about Dr. Troutman's experience inside the Clinical Sleep Kit program. If you are a physician who wants to uplevel your sleep medicine knowledge, go ahead and subscribe to this channel. This is all about practical sleep medicine for you as the physician and healthcare practitioner. I'm Dr. Nishi Bhopal. I'm an integrative psychiatrist and board certified sleep medicine physician. And we talk about all about practical sleep medicine. And if you want a tool that you can use in your practice to support patients with using melatonin supplements, because most of our patients are taking them, but quality really matters. You can get that free download at intrabalance.com/melatonin. You can download that and start using that in your practice straight away. Okay, Dr. Caissa, thank you so much for being here today. I'm really excited for this conversation. Can you tell our viewers a little bit about your background and your specialty areas?
Well, first of all, Nishi, thank you so much for having me. You are my hashtag idol. But yeah, so I am a family medicine trained physician, board certified in obesity medicine, culinary medicine, and also a women's hormone therapy specialist. And as you mentioned, I practice in the state of Pennsylvania.
Fantastic. Yeah. And it's such an interesting combination of specialties that you have, but they're all interconnected, right?
Yes.
Obesity, menopause. Like, how did you get into all of these specialties?
How much time do you have? No, I'm kidding. But so here is what's happening with what happens in my personal life is I think really why I pursued this particular kind of field or perspective. So I am a patient with obesity. I have lost and kept off 32% of my total body weight. And for me, really, it's something I've lived through. I've lived through, and through my initial research and pursuing obesity medicine as a science, that kind of helped me break a lot of the old myths, misconceptions I had about my own weight and weight in general. And because of that, that was where I love doing this, because I can help people, I can help my patients achieve the same level of freedom and success, for lack of a better term. And then as far as the women's hormone therapy, I am a woman struggling through perimenopause and insomnia and sleep, which is kind of why I kind of searched you out. And again, so it's really is, how can I help myself was the first question. And once I realized the science of it and how I can help myself and help other people, that's where it went.
Yeah, thank you for sharing that. And I think it's really powerful when we as physicians, we bring those personal experiences into the work that we do, because it just adds that layer of empathy and experience and trust as well for the patients that we're working with.
Yeah. And it's just, everything is just so exciting. When I read something new, I'm like, oh my God, the science is so still very exciting, as opposed to just, oh, ho hum. Yeah. So I'm just excited when I hear new stuff or cool stuff, or, oh, that applies to me and that applies to this person. So yeah.
Absolutely. I know that I think we're both like lifelong learners, like constantly learning and excited to learn new things and taking different courses and things like that. And so you signed up for my course, which is the Clinical Sleep Kit program. I'd love to hear more about what prompted you to sign up, and maybe like what kind of sleep issues were you seeing showing up in your practice?
Yeah, I mean, so in my practice, I was the medical director of a medical program for obesity in a hospital, community hospital. So I saw a lot of patients, in my practice, I really focus on what we call the four pillars, which is nutrition, physical activity, medication, and behavior change. And under that behavior change tab is stress management and sleep. So sleep is how my patients sleep, if they're struggling with any sleep at all, is really part of the questions that I ask from the very get-go. And we know so much already, some information about how poor sleep or inadequate sleep can affect weight. So there is such an intricate relationship between them. So in terms of problem. I mean, insomnia is, I think, the first one. And again, as I learned in your course, insomnia may not all insomnia is insomnia, right? And that's where, again, I find your course was just so helpful in helping me like practically how to like read through that. Um, I definitely had a lot of patients struggling with sleep apnea, restless legs, but I would say insomnia was kind of the major issue. And on a personal level, I suffer from insomnia, which is kind of again what prompted me to enroll in your course. As a woman in my early 40s, I mean, I think I've always had a interesting relationship with sleep, as you know, with going through medicine, residency, and all the sleepless nights and 2 kids. But it was in my early 40s when I really had that um, trouble maintaining sleep or the wake after sleep onset, which again, in retrospect, that I think that was the perimenopause kind of really rearing its head for me. So I was so super interested. I first watched your YouTube videos. And I was like, man, she talks good sense. And I took your free melatonin class or video, whatever. And again, super practical information. And that was it. I was like, I'll sign up. Yeah. So super amazing.
Oh, I'm so glad to have you in the program. And it's always, like I was telling you before we started recording, like it's always validating for me to know that the information is helpful because so many of us get really limited training in sleep medicine. And then even me, like I did a sleep medicine fellowship, but it's not like you're done learning after that, right? Like it's the
Yeah.
lifelong process. And it's information that we all need to have as physicians working with patients. All of our patients need to sleep.
Yeah.
So
Yep. And I think it's funny. My entire household struggles with some kind of sleep. My husband has sleep apnea. My kids are teenagers. So there's that sleep or that shift disorder or not shift disorder, but that circadian dysregulation a little bit.
delay,
So
yeah.
we all have some kind of sleep issue in my house.
Yeah, and it's like an ongoing thing, right? Like you've got that delayed sleep phase, you've got all the ages kind of
Yes. Delayed sleep
represented.
phase. Yes. Yes.
Um, so I'm curious what else you've learned through the clinical sleep kit program. Like what have you been able to apply in your practice or in your personal life that you've learned inside CSK?
I mean, I think first of all, what I found really amazing, other than the amazing videos you put out and the teaching, is the community. I mean, where else can I chat with a board certified sleep integrative sleep person, specialist, and or the psychologists and therapists that we have who have so much information about CBT-i or cognitive behavioral therapy for insomnia, like practical application. So I think to tap into that resource is just like amazing, and people don't understand how hard it is to do that. I don't have anyone locally in my area that does CBT-i that I can kind of like ask a question to, and that I think is just gold, the ability to get that or ask that question. And then I think in terms of all the topics, definitely the alternative medicine, the supplements was actually the first one that I really, really used. Because again, hands raised, I'm someone struggling with sleep. So, and all the evidence-based information that you shared was good. Because again, I mean, I have no time to like look into all of this and being given like the studies that I can read myself and just like sources and examples was just really good. Like I mentioned earlier, like the sleep apnea is something that we struggle with in our house. So learning how to read hypnograms, and I mean, I just felt like I know what I'm doing. So that was super helpful. I think everything has just been really, really good. Again, I'm just at that prime moment where I just like, oh, I want to learn all of that. I want to learn all of that. And this was just the perfect source of evidence-based information. So I love that.
Yeah, no, thank you for sharing all of that. And like I kind of have spoken about this, like one of the reasons I created this program is because it's what I wanted and didn't exist. Like access to the experts, like you were saying, in the community. And like I just want to like ask my colleagues something or like get some input and feedback. And there really wasn't a space where you could do that.
Right. Right, right. Yeah, I mean, and your experts are not just in the US, they're all over, which is amazing. So
Wonderful. Yeah. So I'm curious how this has impacted your clinical practice. And I know you have like lots of different offerings. You offer support for sleep, you offer support for menopause, for obesity, of course, which is like the core of what you do. So, yeah, how have you been able to incorporate some of the elements of the program into your clinical practice?
yeah, so I think the main thing here is just I am more confident. I mean, I was I knew what sleep apnea was before. I knew how to take care of it by ordering the tests and stuff. But like to actually kind of explain the sleep cycles to my patients, or for me to actually even understand that even though their sleep test was normal, but they're obviously complaining of continued problems with sleep, doesn't mean all is fixed. So that really opened my eyes to what still could be problems. Just again, the tips and tricks about cognitive behavior CBT-i was also super helpful. I mean, I did my own CBT-i training, but I will say that your course and the community that we have really just gave me more practical, and I think you mentioned that earlier, you highlighted this, like very, very practical advice, like, oh yeah, I totally do that. So just like being confident in general with this particular field and just giving recommendations. Yeah.
Great. Yeah. So what advice would you give someone who's maybe thinking of signing up for a clinical sleep kit, but they're not sure? What would you tell them?
Oh my God, just do it. I mean, as physicians, I know we always look at return of investment of our time and our money, but I just think it is such a minimal cost and an amazing return of investment, especially, and I think sleep affects all of us. Like, I mean, whether it affects us in our clinical life or in your personal life, I think you'll just learn so much, even if you started out by being selfish like me and just joined because I want to help myself. I mean, it's worth it. Totally worth it.
Amazing. Yeah. No, and for people who join, they get to work with amazing people like Dr. Caissa here and get feedback. I mean, you provided so much valuable information as well inside the program about obesity medicine and your perspectives. So I'd love to maybe share with our audience some of your favorite clinical tips. A big issue is sleep issues during perimenopause, or if you want to share some tips around that or any other aspects of sleep. Yeah, what would you like to share?
Yeah, I mean, I'm gonna just say for me personally, insomnia was again one of the clearest symptom for me as going through perimenopause. And I think if ever I was gonna talk about anything, is number one is recognizing that it could be a part of the process. And the issue with perimenopause, it's not really talked about. I don't know about you, but for me, I was like, oh, I always found an excuse for my insomnia. You know, and again, true, there is some, right? I mean, obviously, we're all stressed, we're all at a prime of our careers and our lives, and we all have higher responsibilities and obligations. Um, but I think just being aware of that it might be part of the issue, I think, or part of differential diagnosis, I think something that's key. It's interesting. I was reading something earlier this week about how it takes around 7 provider visits before a woman in midlife can have their symptoms attributed to perimenopause. 7.
That's a
I mean,
lot.
what if we just do it in the second or first even, right? I mean, so I think if ever it'd be awareness, right? If we're not aware that this is part of the problem or part of the issue, then we will never get the help that we need, right? So number one is awareness. And I noticed, and you've probably shared this, the most common is the in problem maintaining sleep or the wake after sleep onset, which totally is what happened to me. But it doesn't have to be just that. And yeah, so again, perimenopause, just for someone who's listening and is not familiar, it's that where a woman can still be having irregular menstrual cycles, but is already manifesting symptoms of estrogen and progesterone and testosterone loss or not or lowered levels way before the physical or clinical symptom of irregular prolonged periods start. So an average age of perimenopause is actually 47, but it can happen as early as 35. I mean, when I learned that, I'm like, oh my God, I was like having babies at 35. I mean, it's like, it's crazy. So I think awareness is that it can be part of it. And in terms, so, and again, as you've shared in our community, it's insomnia, right? So getting a workup for restless legs, sleep apnea. And the other one that I learned from you, Nishi, is again how in women, sleep apnea is not the common sleep apnea that we would ask men or that stop bank questionnaire. Sometimes the manifestation is just daytime fatigue. Right. And I think if you poll like 100 women and ask them, do you feel tired? I think all of us will say, yeah. So again, it's that having that barometer or just that awareness that, hey, maybe it could be that. So
Yeah. Thank you for sharing that. Yes. So helpful just to even, like you were saying, have the awareness of, okay, are these symptoms related to perimenopause, so that your patient isn't going through 7+ visits before that's even a consideration. Is there anything else you'd like to share as far as your experience inside of Clinical Sleep Kit, or about your practice, or anything else?
Yeah, so I mean, so much, right? It's like there's so much information to share. But so I would say, like, maybe like for the clinical sleep kit, for anyone listening, like I said, don't even, I mean, I think it's like worth it. The connections I've made and just really the information that's shared in that community is awesome. And I don't think anyone who is directly or indirectly struggling with any of the sleep issues is going to regret doing that or pursuing that. And in terms of like just kind of like what I do, again, the intersection between sleep and weight and menopause or perimenopause is like it's all intricately linked. For the struggle with weight and or obesity specifically, since that's kind of like my major field or my first passion, so to speak, what I always like to tell patients struggling with the medical condition of obesity is it's not your fault, right? Weight loss is not about willpowering it. The old the old data, the old science of calorie in, calorie out is so outdated. And the thing is, it's still so out there. It's still the message a lot of people are being told or are giving, so-called experts in their field are saying. And the thing is, if we use that equation and we use that metric and we don't lose weight, we feel like failures, right? We feel like we're broken. And what I always tell to my patients, especially in the first visit, is like, you're not broken. This is more complex than calorie in, calorie out. Now, that doesn't mean that nutrition is not important. Obviously, nutrition is important. Obviously, physical activity is so important. But the message that I really want to share is just it's not just that. Sleep is a big factor, stress, all of that, genetics, our biology. So if anyone is listening and is really and struggling through some internalized stigma about weight and why is it not coming off? I'm something's wrong with me. If I just had more willpower, or if I just paid attention more, or if I just did XYZ more. So don't feel that way anymore. Get some help. Any obesity medicine trained physician can help you. If you are in Pennsylvania, I am seeing patients. I have a direct care wellness practice and can see patients in person in Camp Hill, or again through video, as long as you are in Pennsylvania. But I think it's really just time to stop the blame and shame, which is so prevalent in our society, and again, people struggling with a medical condition.
Thank you for sharing that. Such an important message. And so if people want to work with you, can they find you on your website or on social media?
Yeah, so I have, my website is www.reMDy.net. And I have all my prices are on the website. I really believe in transparency, so it's all there. I have a weight wellness program and also a menopause hormone therapy program for women struggling through perimenopause and menopause. Anyone that's interested, I actually do a free video meet and greet. Just so, again, that medical advice is not given that visit in that chat, but really just to see for a good fit for each other. I would love to help anyone that's struggling from any of those medical conditions if you're in Pennsylvania.
Excellent. So I'll put the link to your website in the video description underneath. So people go check out Dr. Caissa Troutman's website. You can refer yourself if you're in Pennsylvania, refer your patients to work with her, and come and join us inside of the Clinical Sleep Kit program. Join us in the community. Come and learn together with us. We've got just a wonderful community of clinicians like Dr. Caissa, and lots of learning, lots of opportunities to network, connect, and keep expanding your clinical skill set. So I'll put the link to the Clinical Sleep Kit in the video description as well. Right now, as of the time of recording of this video, you can get on the wait list, and then I'll send you more information about it. And then we're going to open doors in August of 2024. Come join us. And thank you, Dr. Caissa, for joining me today and sharing your experiences and your knowledge.
Well, thanks for having me. I love it.